Ever wondered why some wounds take few days, but some wounds take few months or sometimes years to completely heal? Now, breaking down why wound healing is delayed. There are three primary factors why wound healing can be delayed. First, if there is an infection in the wound, that means your wound is unhealthy. There is some amount of infection where the bacteria is present and the body is not able to take off or clear off that bacteria. The second factor is blood flow to the wound. Whether a wound is like a new plant that is growing or a fresh crop that is growing. You require adequate nutrition, and the nutrition is got by the blood that comes to the wound area. So whether the blood flow is adequately reaching the wound is another important factor. And third, importantly, is whether you have diabetes or no. In case you have diabetes, high sugars impede or delay wound healing by a significant amount of time. So that's why we always tend to check if you have diabetes to help in wound healing. Generally, this is the notion. Wound healing in diabetics take a longer time. And it is definitely true. If your sugars are not under control, your wound will take a very long time to heal. Wound location also is important. Wounds in the face, neck, as well as your hands heal at a much faster rate compared to wounds in the leg. This is mainly attributed to gravity and the blood pressure that is higher on the foot area or the leg area. That's why we see a lot of people with chronic leg wounds and hardly any people with, let's say, a hand wound or a finger wound. In diabetics, because let's say a person has diabetes and hypertension, this is also a deterring factor that wound healing gets delayed predominantly. How do we address this issue? As I told you, the three important factors, we need to address all these three factors. First, with respect to infection, many of the doctors take something called as a pus culture, meaning we take tissue sample of the fluid that is coming out from the wound. We take a sample, we check for the bacterial growth. In case there's a heavy growth or some sort of bacteria that are related to severe flesh-eating sort of bacteria, we may have to cleanse the wound. In case there is a mid-range sort of bacteria where it is just localized to the wound, you can be put on antibiotics, either oral antibiotics or maybe injectables. Sometimes we use some specialized material on the wound. Let's say we can use something like a hydrogen peroxide or a betadine to cleanse the wound. How to cleanse the wound, it's a completely different topic. Probably I'll talk about it at a later time. So keeping the wound clean is a priority. Sterilized dressing, clean dressings are of high priority in such aspects. And one more thing is, which I notice commonly, is many people do not take baths thinking that wound will get contaminated by water. No, sometimes we advise people take bath, wash the wound even with soap and water and then do the dressing. That also helps in debridement or cleansing of the wound. Now, coming to the next factor, whether the blood flow is adequate. People with chronic wounds I'm talking of is any wound that is not healing for more than 2 to 3 weeks is considered a chronic wound. In this sort of scenario, what happens is we have to assess the blood flow to that area. Let's say there's a wound in the right leg and we have to assess the blood flow towards the right leg. So we do something called as an arterial Doppler to find out how good is the flow. Sometimes they may show some minor variations or sometimes they may show certain blocks. If the block is there, then we have to go for a higher investigation called as a CT angiogram of the leg and then address it. You have to increase the blood flow somehow. Either it could be via medication to help the arteries open up, or it could be via a procedure where we are doing a stent or something like an angioplasty, how we do to the heart, we do it to the leg as well. So this helps in increasing the blood flow towards the wound. Third factor is diabetes. Yes, as already addressed, sugar should be adequate control. Sometimes you may require tablets, sometimes you may require insulin, sometimes admission in the hospital to get the sugars under control is also required. Another commonly leftover factor is nutrition. Nutrition is significantly important. It does help in wound recovery. See, adequately high protein diet is useful, but again, if you have diabetes, high protein diet to your kidney may be troublesome. So this has to be checked by your surgeon, what sort of scenario, what medical comorbidities you have. Based on that, the diet can be recommended. Looping in your dietitian will also help. So good amount of nutrition, blood flow, sugars, as well as a clean wound. These are the factors that will help in recovery faster. I hope this information was useful, and in case you have any queries with respect to wound management or any particular delayed wound management, you can always reach out to me. Thank you for your time. Thank you.